The Food and Drug Administration will hold an emergency meeting this Thursday. They're expected to clear the Pfizer vaccine for immediate distribution.
The vaccines are being delivered literally. It'll start next week and the week after. And it'll hit the frontline workers and seniors and doctors, nurses, a lot of people.
But tens of millions of Americans, possibly some in even those groups mentioned by the president, may have to wait much longer for the COVID vaccine. Over the summer, the Trump administration took a pass on buying more doses of the vaccine when the drug company offered to sell it to them. The New York Times is reporting Pfizer now may not be able to provide additional doses until next June because of commitments to other countries. Dr. John White is chief medical officer for WebMD and a public health expert who has worked with the FDA.
The vaccine distribution is starting to look like how we've handled testing and how we've handled PPE. We haven't had enough and we haven't distributed effectively.
The administration decided to buy only 100 million doses from Pfizer, enough to vaccinate only about 15% of the population. Frontline workers and staff and residents of long-term care facilities will be the first to get the vaccine.
When we have the opportunity to buy more vaccine, we don't do that. That doesn't make any sense to me, knowing that we need hundreds of millions of doses, especially when it's a two-shot requirement.
A spokesperson for the Department of Health and Human Services is downplaying turning down the Pfizer offer, saying they didn't want to buy more until it was approved by the FDA. With hospitals at capacity during the holiday surge, we need every dose we can get.
As the hospitals are becoming overwhelmed, it's become a real challenge if we can't protect those frontline workers who are at greatest risk.